Forward head posture has been linked to pain and also headaches. So generally when we talk about posture and sitting, we tell people to squeeze the shoulder blades together and tuck the chin so we're in a nice neutral position. But can exercise actually help decrease forward head posture? And then will that also help with pain? Chances are that you're watching this video and you're probably sitting in a slouched position with a little bit of forward head posture, and that's okay because the research doesn't really show a good correlation between posture and neck pain. But when we're looking at giving advice, we typically tell people that we want them in a nice neutral position. So shoulder blades together, chin tucked, so we're in a nice neutral spine. And one of the most common recommendations to help with forward head posture and just posture in general is exercise. And so there was a recent systematic review published in JMPT, which I'll link in the notes below, that looked at the effectiveness of exercise on forward head posture. The systematic review looked at 7 research articles with about 600 participants, and what they found was that exercise was helpful in reducing forward head posture, and that those who were participating in exercise reported less neck pain during the studies. The exercise protocol used in majority of the studies in this systematic review consisted of 2 strengthening exercises and 2 stretching exercises. The 2 strengthening exercises were a chin tuck focused on strengthening the deep neck flexors, and so what they would do is they would lay supine, so laying on their back, and then they would tuck their chin and hold for 2 seconds and gradually progress to 4, 6, 8 seconds. And they would do these 3 sets of 15 reps. And then the other exercise was focused on strengthening the scapular retractors, so the rhomboids and the muscles between the shoulder blades, and they would do some sort of rowing variation, either with a TheraBand or with weights. The 2 stretching exercises were held for 30 seconds. One of the stretches was for the neck extensors, and so what they would do is they would bring the neck down, so they would tuck their chin, and then they would do a little bit of overpressure with the hand, again holding for 30 seconds to stretch the muscles on the back side of the neck. And then the other stretch was for the pec muscles, and they would do that again for 30 seconds, where they'd either have both hands behind the head or just one, stretching out the front side of the chest. This exercise program was repeated at least 4 times per week, and it went for 10 weeks. The other exercise protocol used was a little bit more comprehensive. What they did was they focused a little bit more on the shoulder, so they had some external rotations while laying on their side. They also did I's, Y's, and T's to strengthen the lower traps, rhomboids, and posterior delt. And then for the stretching, they were very similar as well. They did the chin tuck to stretch the neck extensors, but then they also did one for the levator scap and then also the SCM muscle. For the strengthening exercises, they did 2 sets of 10 reps, and then throughout the program they gradually progressed, eventually ending at 3 sets of 12. And then for stretches, they did 2 sets of 30-second holds. So very similar to the other program, just a couple more exercises. It's important to note that the studies included in the systematic review weren't actually looking at whether changing forward head posture was the reason for the decrease in pain. It certainly can be the case that reducing your forward head posture can decrease the pain, but there could be other factors involved, and looking at other conditions, exercise seems to help decrease the pain. So it could just be that these exercises got people moving and that decreased the pain, or it could have been another factor. Even though the systematic review showed that exercise can help reduce forward head posture, which is pretty cool that we could just strengthen the muscles and change our forward head posture by about 4 or 5 degrees, I think that we should focus more that exercise can help reduce neck pain or posture-related pain as well. Otherwise, it can get a little bit too complicated. So if we look at how they measure forward head posture, there's a little flap on your ear called the tragus, and so they mark one point there and then the other point on the 7th vertebra, so the spinous process of the 7th vertebra, and then they have one line that's true horizontal, and so the smaller that angle is, the more forward head posture you actually have. So I know that's going to complicate things a little bit more, but if we look at somebody who has 30 degrees of forward head posture, meaning that they actually translate their head forward more, versus someone who has 60 degrees of forward head posture, so they actually have a little bit better posture, well, the person with the better posture might have neck pain, where the person with more forward head posture might not have neck pain. And so if we're looking at the angles, that gets a little bit complicated. Instead of just going, well, if we have an exercise program to help strengthen the deep neck flexors, strengthen the muscles in between the shoulder blades, and then we have a stretching program to help stretch out the neck extensors and the pectoral muscles, well, we can help improve the forward head posture, but then also reduce the pain as well. So to keep it simple, we can do some strengthening for the deep neck flexors and then also the muscles in between the shoulder blades that helps pull them together. And then we can pair that with some stretching for the muscles on the back side of the neck and then also the chest muscles as well. And regardless of the actual angle of forward head posture, that person can see improvement in their symptoms. Thank you for watching this episode on forward head posture. I hope that you found this information useful. If you did, go ahead and give this video a big thumbs up. And if you want to see more of my content, go ahead and hit that subscribe button, which pretty sure is on this side, but you know what, just to cover all my bases, if it's on this side, go ahead and hit that subscribe button too. It's that red button. And if you want to be notified as soon as I post a video, go ahead and hit that bell button as well.